Toronto is a beautiful, bustling metropolitan city full of creativity, community, social connections, culture, and heritage. As a city, Toronto contributes its own undeniable ambiance and presence to not only Canada, but to North America as a whole. Yet, all is not what it may seem. Behind the scenes of this urban landscape, there is something darker going on that needs to have a spotlight shown at it. Specifically, Toronto is quietly facing complex yet clear health inequality issues. In 2021, nearly 1 in 5 individuals experienced household food insecurity in the past year. The rising cost of housing contributed to 40% of Toronto tenant households spending more than 30% of their household income on shelter costs in 2021. And shockingly, in 2021, there were over 7,300 people experiencing homelessness on any given night. Toronto also faces a devastating drug poisoning crisis. Health and social harms are often associated with substance use, including alcohol, marijuana, nicotine, and illegal substances. According to the Toronto Public Health, between 2015 and 2022, close to 2,900 people died of opioid-related toxicity in Toronto. Urban prosperity and health do not always go hand in hand, especially as financialization and inequality increasingly characterize cities. As we know, financialization is one of the main features of the global economy, and this means that it places financial capital at the center of economic activities, and cities become gathering places for financial institutions. Issues surrounding inequality have become more evident in cities, and the uneven distribution of wealth and resources has led to a further divide between social classes. There is an urgent need to deeply examine the relationship between financialization and inequality. But why? This will allow us to understand the roots of health inequalities in modern cities and provide a scientific basis for relevant policy development. This also helps to improve the overall health of urban residents. Thus, we pose the following question: how does urban financialization and economic inequality resulting from neoliberalism affect the physical health of North American populations? This video will explore 3 variant approaches to solutions in understanding this issue. 1. Promotion of the sustainable development of the financial system. 2. Promotion of the equal distribution of social welfare. And 3. Strengthening the social fairness of urban planning. The health status of the population is directly affected by the urban structure and social system in which it belongs to, and in North America it has seen profound changes since the emergence of neoliberalism in the 1970s. The core concepts of neoliberalism emphasize market power in private institutions and advocate reducing government intervention to promote economic efficiency and free market competition. In North America, economic policies underwent a prominent shift towards neoliberalism during the 1980s and onwards. This has had a profound impact on the urban structure and social relations. Cities have become the primary engines of capital accumulation and economic growth. Yet, this urban prosperity has not been equally beneficial, nor necessarily beneficial at all, to all North Americans. Urbanization is thought to have brought economic vitality, cultural diversity, and social innovation, but has also caused cities to see a widening of the gap between the rich and the poor, has fueled the housing crisis, and has been complicit in social exclusion. The financial crisis and economic instability have had a negative impact on the mental health and quality of life of urban residents. Fluctuations in the financial market and the occurrence of economic crises often lead to job insecurity and reduced income, making many residents feel increased pressure to make ends meet. This uncertainty and stress can translate directly into mental health issues such as anxiety and depression. Finally, it has also made the distribution of medical resources more uneven, making some disadvantaged groups in cities face greater health risks. In cities with higher degree of financialization, medical resources are often concentrated in wealthy areas, while poor communities face a shortage of medical resources. This results in residents being unable to obtain fair and high-quality medical services when facing health problems, which further widens health disparities. Thus, it is clear that inequality is an inevitable product of neoliberalism, and it is even more pronounced in urban contexts. In cities, high income groups have easier access to high quality medical services, high quality educational resources, and comfortable living environments, while low income groups often face problems such as shortages of medical resources, limited educational opportunities, and poor living conditions. This inequality has led to health disparities between different social groups in the city, forming a phenomenon of polarization in which some people enjoy the various conveniences brought by the city while others fall into health risks. On the other hand, inequality in cities affects socioeconomic status, which in turn has long-term effects for population health. In cities with high levels of inequality, people with lower social status are more likely to face problems such as career instability, low wages, and insufficient social services, thus increasing the risk of disease. This difference in socioeconomic status is directly reflected in health status, making lower-class communities more susceptible to health risks such as chronic diseases and mental health problems. Tied into all of this is the housing crisis. High housing prices and rent levels make it difficult for many residents to afford safe, hygienic, and spacious residences. Poor housing can result in a range of health-related problems, including indoor air pollution, mold growth, and safety hazards. Housing inequality also causes social stratification, which affects the overall health of low-income people. Homeless individuals must also be put into consideration. Homeless people may face harsh living conditions and tend to suffer from illness, hunger, and disease. The lack of basic housing security makes their health status more vulnerable and has become a prominent aspect of urban health problems. It's a product of economic growth-induced inequality, rooted in housing costs growing at a faster rate than urban residents' incomes. Another health concern for urban residents is drug abuse, which impacts individuals and society as a whole. The presence of drugs in cities poses a threat to urban health. A recent example of this is the opioid crisis. Unemployment and social insecurity have exacerbated the psychological stress of urban residents, and drug seeking has become a way to escape reality. Inequality makes it harder for low-income people to access good education and employment opportunities, increasing their risk of falling into drug abuse problems. Inequality also makes poor communities more vulnerable to crime and the drug trade. Drug abuse itself has become a manifestation of poverty and inequality, forming a vicious cycle. Finally, there is a strong relationship between housing problems and chronic disease. Living in crowded, damp, or unsanitary conditions can lead to the development of chronic diseases. Low-income communities are often more susceptible to chronic diseases due to limited living conditions. The rapid development of the food industry caused by neoliberalism has led to the prevalence of convenience foods and high sugar and high fat eating habits, which have become important causes of chronic diseases. The commercialization of the medical industry has led to rising medical costs, which have made it difficult for lower-class communities to afford medical expenses, limiting their accessibility to medical services and delaying the treatment and prevention of chronic diseases. This leads us to pose the question, how, through policies, can we improve the health of North American urban residents? We can promote the sustainable development of the financial system. This encapsulates the coordinated development of financial activities, society, and the environment to achieve economic, social, and environmental sustainability. A sustainable financial system encourages financial institutions to pay more attention to social responsibility and improve the quality of life of urban residents by investing in social welfare projects and infrastructure construction. And emphasizing environmentally friendly, sustainable financial practices can help improve the urban environment and reduce the health hazards of environmental pollution. Long-term investment promises to provide urban residents with more stable and reliable employment opportunities, reduce the pressure of social inequality, and thereby improve overall health. We can also promote the equal distribution of social welfare. Through the equal distribution of social welfare resources, it can be ensured that all residents have equal access to basic medical, educational, and housing services, thereby improving overall health. Equal social welfare policies can help reduce the gap between rich and poor and alleviate social tension, thereby reducing the mental health problems faced by urban residents. The government should use tax policies and social welfare systems to reduce the gap between rich and poor and ensure a more equitable distribution of resources and services. In addition, establishing an inclusive education and training system and improving the socioeconomic status of low-income groups can help offset the negative impact of inequality on health. And finally, by strengthening the social fairness of urban planning. We need to ensure that different social groups in the cities can share the dividends of urban development. Planners should consider social and environmental sustainability and focus on the balanced distribution of public spaces and service facilities to alleviate social inequalities within cities. Housing allocation is a crucial aspect of urban planning. Socially just urban planning can ensure that every resident has a stable place to live by implementing affordable housing projects.